When you plan to conceive, whether you are under 35 or over 35, the first thing is to visit the gynecologist for a preconceptional check. When they order for certain blood tests and ultrasound scan, and the partners are also tested too. After that, we come to know whether there are certain deficiencies or any other concerns happening in your body which needs to be fixed before you plan for conception further. Your gynecologist will also start you on folic acid, which is a vitamin required for the proper development of the nervous system of the baby, and ideally it should be started 3 months prior to conception. So start as advised by your gynecologist. Now, if in case there is any problem that is found in the ultrasound scan, obviously that will be fixed, but if there is no problem at all, then just be patient. By saying what I mean patient, because in one particular cycle only 10% conception happens. That means if a perfectly normal healthy couple without any infertility concerns is trying for conception, there is only a 10% chance that they will be successful in that particular cycle, which would mean that just after one cycle, don't panic that you are not conceiving, right? So for ladies who are under the age of 35, we say that they can try up to 12 cycles before we say that they have got any concerns in conceiving or infertility. While for somebody who is over the age of 35 or over the age of 35, it is 6 months, that they should try at least for 6 months, provided no other factor apart from the age was recognized as the reason for decreased fertility in the preconceptional investigation that your gynecologist got it done for you. If by chance there was any other associated finding, like say a fibroid or endometriosis or something, which adds on to the increasing age as the cause of infertility, then obviously you need to see the infertility doctor earlier than that. Not try for 6 months, because more you wait, your egg reserve starts getting less. I will come back to this point later, that why we are talking about conception after 35. What are the things which happen differently from when you have tried to conceive at say 25 or 30, and how it differs when you try to conceive at 35. So now you will be trying for at least 6 months for conception. You need to know what your fertile period is. The fertile period depends upon the overall length of your cycle. Somebody who has got a shorter cycle, like say a 21-day cycle, will have a different fertile window as compared to somebody who has got a 28-day cycle or a 30-day cycle or a 32-day cycle. So just figure it out with your gynecologist. There are certain apps as well available. You can feed in them as well, and they can give you your fertile window, and that is the time when you are trying. If you're having sex at least on alternate days, that is when your chances of conception increases. Now, while you are doing all this, trying to conceive, try to lead a healthy lifestyle. And what is a healthy lifestyle? When you are eating healthy, when you are exercising, and I have already done a video on diet and fertility, so just go through it, and that will tell you what are the diets which you need to take to improve your fertility, what are the diets that you need to avoid to improve your fertility. So be on that kind of diet. It is nothing fancy, it is the routine day stuff that we eat, but we have to be very mindful about what we are eating. And it is a good idea to exercise. If you are overweight, try to shed some weight, because less is our fat, better is the egg production and ovulation. It is more efficient, the sperm produce is of better quality. So incorporate all that in your lifestyle. Now suppose you have tried for 6 months and you don't find any result. That means you haven't fell pregnant. Then what happens next? Without wasting your time, meet the fertility specialist. Why so? As we age, our ovary, it gets devoid, the amount of the follicles which can produce egg, it decreases. That is how human body is. When we are born, there are millions of follicles there in the ovary, but every time a female ovulates, there is only one follicle which becomes the dominant egg. but along with it, at least 300-350 follicles get destroyed, and which would mean that slowly as we grow older or our ovaries grow older, the amount of follicle there decreases, and whatever is remaining there, the quality of them is not as good because there is effect of aging. So the quality as well as the quantity of the egg starts to deteriorate as aging occurs, and there are many studies to suggest that after the age of 35 there's a sharp decline in the fertility of the females for that particular reason. So what happens when the quality and quantity of egg becomes less? It becomes difficult to conceive because usually nature tries that only healthy conception occurs. That is the intent of the nature. So if the eggs are not healthy, then fertilization is not happening, and if that is not happening, then that leads to infertility. So that is one concern. Second concern is that if in case fertilization happens and if the egg is not of good quality, then what happens is that the rate of the miscarriage increases, because obviously fertilization has happened, implantation has happened, fetus is growing inside the uterus, but nature, as I told you, nature doesn't want a unhealthy fetus to grow further, so it miscarries it. So incidence of miscarriage increases in ladies over the age of 35 for this particular reason. Nothing wrong with their body except for this particular reason. Now, third thing, again because of the aging of the egg, the incidence of Down syndrome and other genetic problem increases. The chromosomal problem increases in females who conceive later, in the babies of these females, because again the egg is not of good quality. There is effect of toxins and aging and the oxidation that has happened in it, so that can lead to trisomies and Down syndrome, and that is the commonest reason of the mental retardation in babies world over. So these are few of the things which happen when you are trying to conceive after the age of 35. Also, because whether it is a male or a female, we know with increasing age the possibility of having other medical condition also increases, like say diabetes, blood pressure, thyroid. So there are so many conditions because our body is always in dynamic state. It changes as we age. These medical ailments can come in, and that can also affect the pregnancy. So these are the factors which why we are doing this particular video, trying to conceive after the age of 35. So though I have explained what are the things which can go wrong and why you should be concerned if you are trying to conceive after the age of 35, I don't mean to say that every lady who will try after the age of 35 will have these challenges or face these challenges. It's simply to say that the incidence of these problems gets more when you are trying to conceive after 35. So what do we need to do? Now, Down syndrome is something, as soon as a lady comes to know that there's a possibility that the baby can have Down syndrome, they get really stressed about it. So, well, there is no way to know whether a baby has got a Down syndrome or not if one is trying to conceive naturally. I mean, what I mean to say naturally is if you go for a IVF treatment, there we can know beforehand whether baby has got Down syndrome or not by a method which is called PGTA. That test helps us in knowing it beforehand. But if you're trying to conceive it naturally, there is no way to know it unless you have conceived, and there are certain tests which are done which will tell us whether the baby has got low risk or high risk of having Down syndrome. And the most efficient screening test which is present for Down screening at the moment is called non-invasive fetal DNA testing, and which has got an accuracy of 99.9%. So isn't it reassuring that one can pick up, of course one cannot prevent Down syndrome, but one can pick it up, and if in case the parents don't wish to continue with a Down's baby, or termination of pregnancy is an option just in case it happens. Again, I'm saying that not all the ladies who are going for pregnancy after 35 will face this problem, just the chances of having it increases. Now, suppose you are trying for conception for 6 months and still the pregnancy hasn't happened, and you have visited the fertility specialist. What are the things that you can expect? You can expect your fertility specialist to suggest to you ovulation stimulation, where medicines are given from outside to make your body produce egg. Even if it has been producing egg, when the principle on which the ovulation induction works is that when you take these medicines, there is a possibility that more than one egg might be produced, and obviously when you are having sex, the probability of conceiving becomes more as there are more number of eggs. Of course, it increases the chances of having multiple pregnancies as well, but then it is it is how we start when we go for an infertility treatment. Now, suppose the ovulation induction doesn't work. In that case, there are methods like IUI and IVF, which I will discuss in other video, that one can always resort to that if one is unable to conceive through ovulation induction only. Now, there are times when the ladies after 35, they decide to conceive and that they find that there is something called AMH, anti-Mullerian hormone, which is directly proportional to the ovarian reserve that female has got, and it is really very low. So if it is very low and there is another hormone FSH, it is very high, then the theoretical possibility of conceiving with that particular kind of a blood report, it becomes less. In that case, there is another option. If you really badly wish to have a baby and you don't have your own egg, then you can opt for donor, where the donor is a female who donates her egg, and the sperm of the male partner can be used to fertilize the baby outside in the IVF lab, and that can be put inside your uterus. So genetically the baby won't be yours, but technically you will be mother, as you will be the surrogate for the baby and you will be carrying the baby in your womb. So to conclude, though I have told you an overview of what it is, why it is different from conceiving at less than 35 over 35, I again wish to tell you that calm down, take a breath. It is not as if you're over 35, you're doomed. It is not as if you will definitely face all this problem. Majority of the females or the couples, they don't face any such problem. Try yourself for 6 months after getting the preconceptional test done, and despite that, if you're facing problem, meet the fertility specialist and we are there to help you. Don't get despondent, don't get disappointed. Actually, it is not as much of a big deal as it has been made, and I have seen so many patients more than 35 conceiving easily, having a smooth pregnancy, having smooth deliveries. So don't leave this video on a sad note. It is to say that there's lots of hope, even if you are trying to conceive after the age of 35. Just do try if you are trying to conceive. And if you have any questions, please feel free to put down here in the comment section. I will be more than happy. If I don't know the answer, I will check and I will come back to you. And if you like the content that I have provided in this particular video, please like, share, subscribe. If you don't do that, that is still okay, because I wish to talk to you and that purpose is served. So I'm happy, and do stay tuned in. I will come up with another information regarding the female health, fertility, obs, gynae, and you can also suggest what you wish me to cover and I will definitely do that. Till then, we meet next time. Have a nice week ahead. Bye bye.